You've heard of rom-coms where the guy always gets the girl. You've seen drom-coms where 1 minute you're laughing and the next you're crying. Well, this is TraumCom, where we face our inner demons head on. You know, the ones that caused us all that trauma. And then we're going to make fun of them together until they get real uncomfortable in a fun yet supportive space. Hello, everyone. My name is Jacqueline Goldstein, and I am your host of TraumCom Podcast. And today we have the lovely LaTanya King, and she is a therapeutic APRN, and she is here to talk to us today about some of the work that she does, and also how she came to do that work and love that work, and some of the challenges that it can face, right, every day, day-to-day work. It is March. And that means it is International Women's Month. I'm honored to have LaTanya on today because absolutely, I mean, you're such a strong woman and
thank you very much. Active
member of the community, and I really appreciate you taking the time out to be here with me today.
Thank you. I feel very welcome. So thank you very much, Jackie, for the opportunity.
Absolutely. So LaTanya, tell us a little bit about exactly what you do, what your title stands for, and where are you working? What do you do for a living?
Sure. So I'm a psychiatric nurse practitioner. Sorry, not used to speaking in a mic.
You're good.
But I'm a psychiatric nurse practitioner, which is also an advanced practice registered nurse. I have been a nurse for over 22 years. But in 2019 is when I pursued my advanced degree as a nurse practitioner. Psych has always been a passion for me. I started off actually in orthopedics, working at Hartford Hospital, doing a total joint. I did that for about 5 or 6 years, and then I transitioned to DCF, working with children with psychiatric and behavioral health issues. Okay. So that's where I kind of got my
wow, that's a lot.
Bite working and seeing mental health at a young age, and kind of understanding, trauma that occurs in younger children and how it affects adults when they get older. I've always been a type of person, I get bored very easily. Mm-hmm. That's part of my ADHD.
Yeah, I totally am undiagnosed.
So I'm always constantly doing something and always need to kind of keep busy. And it's not that working with DCF was boring. It was just more of the fact that I felt like I needed to challenge myself more. So I started working per diem about 2 to 3 times a week, working, it's called the Acute Behavioral Unit, the ABU, in New Britain General, or it used to be New Britain General, but now it's the Hospital of Central Connecticut in New Britain. Okay. So I did that for over 10 years. Wow. And then at some point in time, I was like, okay, maybe I can do my own thing. So I left the state. I quit my my per diem job, and then I started working in Springfield at a place called Caring Health Center. That was my first APRN job. And then a couple of people had this crazy idea that they thought I would be good enough to have my own practice. I'm like, I don't know anything. So how am I going to practice and I don't really know anything? But I was crazy.
See things in us that we don't see in ourselves right
True,
away,
very true. But I did. I opened up my own private practice on my birthday.
Congratulations.
In 2019. Thank you.
I love that.
And still working, kind of nurturing my skills and understanding mental health in general, working at the clinic and Caring Health Center. Got promoted within 9 months, becoming their director of behavioral health. So
why not? Of course you did, right? Like, what?
So on top of running a private practice and seeing clients, I was also running the department there. So it was such an experience, and it was literally, I met some of the best people of my life. Was treating substance abuse, running the MAT clinic, so anything with Suboxone, Sublocade, Vivitrol, alcohol use, all of that.
Where people were like experiencing withdrawals, physical withdrawals.
I was able to be able to treat them and also treat their underlying mental health, because usually mental health and substance abuse is comorbid. They tend to go together.
Yeah, hand in hand. I mean, it's almost like you can't have one without the other.
Exactly.
Unfortunately.
And then from there, I felt like I kind of got wounded there. And it's so interesting. Like, I don't want to say too much, but more so the fact of, I look up to, anyone who is in a position of power, especially, I kind of look at those people to kind of be like a gatekeeper. And, to work for an agency where the top heavy was very mixed with Hispanics and Blacks and people from Jamaica, Haiti, and it was such a integrated, beautiful place to work and to be kind of treated or mistreated. It was very unfortunate. So that led to me leaving, and at that point, I kind of focused on contract work. Which contract work is basically you work for yourself, but you kind of contract your services out to hospitals or other agencies that need you because they are in a tight bind with coverage.
So like subcontracting work. So okay, so that's really good work, though. I mean,
it is, and honestly, it's financially profitable. Yeah. The money is shmoneying. It's nice.
Okay, we need shmonies.
So the money is good.
We can list that as one of the factors into like your pursuit of the career. Okay, I got you.
But yeah, so I did that, and then of course continue to build my private practice. My private practice is located, is named Hope Life Behavioral and Wellness Services, LLC. I hope that's not a shameless plug.
Say it again. Say it louder.
Hope Life Behavioral and Wellness Services, LLC, and is located in Avon, Connecticut. Right now I have about 5 or 6 employees, another APRN, and about 4 therapists. And I'm looking to expand.
Okay.
But we see patients in person and also virtual. And right now we're managing about between 600 and 700 patients.
I really applaud you for that.
Thank you very much.
Honestly.
Thank you.
I'm so happy to have you joining us for this International Women's Month episode. You are the embodiment of a strong Black woman who has made things happen for herself in a community where it's not always so friendly for every single ethnicity to get into with the mental health game. I know that there are significant challenges that minorities in specific face.
Oh, for sure. I definitely have had some unfortunate situations that has happened, and I think just being a person in general of color, it's not uncommon that you run into situations where you are marginalized or, people take credit for your work. You are disparaged and kind of told in many different ways that you're not enough. And I think sometimes when it happens, especially at an early age, over time, you start to think that that's normal. And, when you start to rise up the rank in your career, you would think that it would get a little bit better. And a lot of times it gets worse, which is, I don't understand that part. But yeah, like I've had, especially in psychiatry, if you think about the structure of psychiatry, when you think of a psychiatrist, what comes to your mind? Like white, old male.
Freud, maybe.
Yeah.
Something Freudian. Or, little Freudy.
Little dry.
Yeah,
little,
maybe,
little kooky.
Glasses, older, lay back on the couch and tell me all your woes as they're writing and taking their notes and judging. And a lot of times there's a, which we've talked about on the show before, a predisposed negative stigma on therapy itself, people who need it, people thinking, well, I don't need help because it sounds like they're vulnerable and they need help. But in saying all that, there's so much more to the fact that you're an advocate for so many people to go into an office and feel comfortable and look at and talk to people that look like them It is important to feel some kind of relationship, right? And to be able to identify and not feel like you're, just out of place maybe. Or, I know that you make all your patients feel comfortable, but it is something to say when you are taking a group of people who have been, in many ways, filtered through the cracks of the system, and you're making them feel welcome and heard and seen.
Yeah, because from my experience, doing especially medications, like that's primarily what my role is. I do medication management. Yes, I can do psychotherapy, but if you're talking to Black and brown people and their idealism of, and I'm Jamaican, so
Okay.
we like.
Okay, so
we don't do meds.
So tell us a little bit about, like, let's insert a little bit about what being Jamaican plays a role in your actual personalized approach.
Well, I think part of it also
mindset
too.
even.
No. I just think part of it, a lot of it is just the way how you grow up. Like, I grew up very religious. My dad was a pastor. My mom was an evangelist. And a lot of things, not outside of just cultural norms, it's more about just praying it out, or,
Having
this is
faith.
happening to you because your faith is not strong. And, maybe my faith is not strong because I'm depressed.
Maybe right now it's not the strongest it could be, but it doesn't mean it's gone.
Exactly.
Or it doesn't mean
or
I don't
believe. Exactly.
It's just right now I'm going through some shit.
Exactly.
And I don't know what to do about it. I don't know what to think. I don't know how to feel. Who to turn to. Why this is happening. I don't understand. So when we don't understand, we question everything. And sometimes that includes our faith. And that includes who is looking over us. And sometimes our faith might not be the strongest that day, that week, that month, that year. But, in your culture and in many cultures, and I'm a spiritual person, I grew up, my mother raised me Catholic. My father was an atheist, but his father was a Hebrew.
How did that work?
Hebrew, Russian Jew, my grandfather. My dad just was like, I don't believe this shit. When we die, we die. Like, we're worm food.
Right.
And then my mom raised me Catholic in the Sunday school and all that. And then, so by the time I was about 12 years old, I was so fucked up. I was like, I don't know what. But right now, I've come to a place where I know that there is something out there, a higher power. And, having faith does bring about so much warmth and a little bit of security when you are having those low faith days, which we're all allowed to have. But go on. I know in your family having low faith day probably was like,
just growing up. It was
not great.
Well, first thing first, I kind of grew up and it was like children were seen and not heard. So that's the first thing. Like,
I know about that.
I was not allowed to ask questions, and whatever was said. And of course, this is my perspective. I'm not accusing my parents or saying they did anything wrong per se, but I just think that's just how I was raised. Yeah. So if you're already raised in an environment to not say anything or you're not seen, then that's gonna mirror a lot of how you feel. Well, where can I turn to and where can I go if no one's gonna listen to me anyway? Yeah. So I think, as a child, especially because I was bullied a lot. So I think as a child, there wasn't anyone to really kind of talk to. And the way I was told to deal with it is to, like, don't come back in the house until you beat their ass. So, like, that's basically how it went.
So, okay. Did you have siblings?
I have a younger brother.
Okay.
So we're 9 years apart.
Oh, okay. So you had a much younger sibling. Okay.
So I kind of ended up being
really
his
caretaker
at
with,
time. Yeah,
with
no,
him.
I was kind of like a single child.
And then your parents were tough on you and encouraged you to have faith at all times. But so the bullying factor, I mean, God, that's really not. That's really sad. How old were you when that was going on, and how long did it last? And
I think the bullying started when I was living in Mass for a while, and then we moved to Waterbury. And I think because I wasn't from there, you were already an outlier because you didn't go to the same school as everybody else. Like everyone went to the same elementary and then they transferred over to middle school. And here I was just coming there and struggling to make friends. And I think for me, I made friends. And I think I think I was like maybe, like 12, 11 or 12. That's when it started to get bad. Like I got jumped. I'll never forget. I got jumped by 7 girls and 1 guy.
How old were you?
I was about 12. I was about 12. The boy was like, had to been like 18, 19.
Oh my God.
Bust my mouth with brass knuckles. But I didn't fall though. You ain't knocked me out, pussy. Anyway.
Yeah.
But
pussy.
But at the end of the day, like, you know, those are the things I kind of like dealt with.
I hope they all see this right now. Because look at how good you're doing for yourself.
I mean, honestly, those experiences, I carry them with me, but I don't mourn them. I really think all those experiences had built character in me and made me a lot stronger. Like, don't get me wrong, I didn't deserve to be bullied. I didn't deserve to.
Was it just because you were like different, came from a different
I think
place
I was just
overall?
different, and you know, my mom suffered from mental health. That was something that was very taboo. We didn't talk about it. So I think because my mom couldn't really take care of herself, she struggled to take care of me. So I kind of repeated the same clothes. Yeah. You know, I remember one time I was like, oh my God, I can't keep washing the same thing and wearing the same thing. So I would wear my dad's church shirts and like tie them up and try to make them cute.
Freak it a little bit. We all had to do that sometimes.
I tried to do something to kind of, but you know, they figured it out. There was like, oh, why are you wearing a business shirt? Like, I did the best that I could. Yeah. But, you know, I don't, even now, ruthless, I don't blame, because she couldn't take care of herself. So if she can't take care of herself, then she can't take care of me. Of course. So, and, you know, and I was a single child for a long time. Right. So I just had to make it work.
You did. Yeah. So, okay. Well, you did make it damn work. You made it damn work. And I really appreciate, again, like all of the honesty that you're sharing with us, because I know that sometimes it might not be easy to like think about things like that and even understand like, wow, something like that actually happened to me and I'm a good person. Yeah. And that sucks. And you're not alone.
You know, I never questioned why it happened to me. I never did. No. I never ever questioned.
Did you kind of feel like you knew why?
I don't think I knew why, but for some odd reason, I just felt like this was normal. I think when you grow up in an environment that's chaotic and toxic, if that's all you know there's better. Like, you know there's better, right? Yeah.
But you feel like there's better, but you don't really know. You feel,
but you don't. Okay, correction. Absolutely, 100%. Right. You feel like there's better. You can't really say you know because you're in it, right? Mm-hmm. But I think for me, because it was just happening all the time, I never really thought it was anything where it's like, oh my God, like I'm a bad kid, like this is what's happening. Mm-hmm. I don't think I really realized like, okay, something has got to give until like I viewed school as a way out. Okay. And that's what connected me. Like I was like, education is going to get me out. Yes. That's how I can break the cycle. If I could better myself and put myself in a position where I never have to depend on anyone to clothe me, to make me look good, to have my hair look good, to do whatever, then I'll be okay. Mm-hmm. But, you know, hyper independence is a sign of trauma.
I was just about to say, we have to be careful with how independent we view ourselves because, as you just said, hyper independence, I'm right there with you. Mm-hmm. I was an only child. My mom had substance abuse issues, and it was hard growing up. And I was so guarded that I didn't even tell anybody about the issues that I was having, you know, with my mom in the household. You know what I mean? I never went to school and shared anything. I didn't tell a lot of my friends anything because I was embarrassed. Mm-hmm. But I think if I had, and if other kids knew, and I'd opened myself up and other kids knew that my mom was on drugs and I was being left home alone and I was having issues, we were having issues keeping the electricity on and there wasn't really all that much food in the house all the time. Little things like that. I think if they knew, I would have been susceptible to a lot of bullying situations myself.
Mm-hmm.
And that
I
was
can see
my
that,
way
for sure.
of keeping myself guarded. Like, if they don't know anything, nobody can say anything. And I've learned that about myself, but at the same time, trying to do that as an adult is really hard.
It is. It is. It's hard, and because what happens is you go into survival mode. You go into survival mode, self-preservation. You're doing all these things, but you also are missing out on the part of having people model what it's like to kind of deal with these type of issues in a healthy way, create resolve, but not necessarily have those situations shape you. Yeah. And I think for me, I didn't have anyone to show me that. So I put all my eggs in one basket and was like, okay, education will get me through. But then think about all the things I missed out on. Like, I didn't have anyone to teach me, this is what it's like when you get into a relationship with a person. Like, I feel like all those things led me to have further traumas in my life. I think another thing also, too, is growing up that way, outside of the bullying, like, I don't think I've ever felt protected. Right. And a lot of the times when I talk to my patients, when they talk to me and some of the things that they're so angry about, I ask them the question, like, growing up, whenever did you ever really honestly felt safe and felt protected? And they will break down and be like, I don't think I ever have.
Don't even know what that feels like.
They don't know what that even means sometimes. I mean, they know what it means.
They know
but
what
not
it
in a
means,
sense
but they don't know
what it feels like. Right.
And that's so sad. And also, like, in you saying that you didn't really have anyone to show you how to be in a relationship, how to emote properly, how to react to certain different situations the way that you wanted to react because you were stifled emotionally and verbally a little bit. Not all the time, I'm sure, in life, but just to a certain degree because, like a lot of people in my family, children were to be seen, not heard. And that was the big overlying message that we kids got when we were younger. Like, doesn't really matter how we feel at all.
Well, and then I think that's another thing too. We didn't talk about feelings.
Exactly.
Like, what do you mean you're sad? Like, what are you talking about? Go to bed.
Yeah.
Like,
you're crying.
Go
Let
do
me give you
some
something to cry about.
Like, exactly. So it's like you didn't
know
really,
because they had it so much harder than us.
Yes. So they're looking at you like, what's wrong with you?
What are you even crying for? Like, you have a household over you got a roof over your head.
I said, what you bought for? Yeah, food. So go yam something. Like, I get it.
It's generational shit that they're carrying on to us. It's the emotional baggage, but it hurt us.
Yeah.
It hurt us. So when you say that, so getting back to you saying, you weren't really shown the right way how to do certain things, right? Even just like emotionally. How do you feel when you're giving that kind of advice and structural support to your clients and your patients?
Well, this is where the lines get really tricky because when you're a provider, you have to be very objective and try your best not to, because sometimes you have to resist the writing reflex, meaning it feels so real to you or the patient's experience that you connect and you think of ways of how you've endured and survived it, that you try to kind of lead that patient down that path. And that's actually wrong. Like, you have to kind of learn how to separate your emotions from the patient's situation, even if it resonates with you. What I do, and when I have patients talk about, not being able to, they never experienced it or don't know, before you can do that, you have to first feel it for yourself, because before you can even connect to anyone else, a lot of patients have a lot of insecurities about themselves where they don't really like themselves. They don't love themselves. Yeah. So I can't expect them to model certain behaviors in a relationship when they can't even model it for themselves.
Correct.
So
And they need your guidance.
exactly. So a lot of the times when I'm working with patients, if I'm doing psychotherapy as opposed to med management, because,
What is the difference between psychotherapy
Oh,
and
so
med management?
psychotherapy or therapy is basically, in my definition, psychotherapy is more, it's more an additive to medication management. So
Okay.
you're doing therapy, but it's more talk,
Emotional.
and you bridge it along with medication. So, for example, if you're coming for your refill, some providers are very just like, is the medication working? Are you having any adverse side effects? Are you good? Okay, bye. That's why if you hear people's experience, sometimes they don't like going to their med provider because they feel like they don't listen to them.
So that's like more the psychotherapy
Yeah,
side,
they're
and
just
then, like,
focusing.
the med management is
No, that's more med management.
Okay,
They
yeah.
just feel like they're just focusing solely on the meds,
Right.
but they're not asking or eliciting questions to understand
Right.
why I feel the way that I feel. And honestly, largely that happens because the way the programs are set up now is to separate therapy from med management. Like for APRNs, they really just want us to just plug it in, order the meds, and keep it going.
You would think that they'd want to keep them connected more.
I think what happens is because both of them are very heavy, they're thinking, let the therapist do their work, give them the skills and tools that they need, and then you focus more on the symptomatology and you do the treatment.
And you can make referrals as
Yeah, and you make
needed in
referrals as
between.
needed. And I get it. Like, I'm not saying that that's per se wrong, but what I will say is if you pigeonhole to only focus on medication management, you're going to miss some things.
Yeah.
If my patient is coming in and I'm noticing that they're not getting any better and I just keep jacking up the meds, I think I probably should ask questions like, well, what changed for you?
Right.
What if that patient is in an abusive relationship, but I've never asked any questions about what's going on in their personal life?
Yeah.
And don't get me wrong, there's no pill for that. But at the end of the day, if they're in a traumatic situation, of course their depression and it's not going to get any
And
better.
not only that, but these people are coming to you for guidance and help. And when you're giving them the line, for the sheep to go into every week, okay, you do this, you get your stuff, you answer the questions, you go out. And if you're giving them that overall structure, that's what they're going to follow.
Right.
And that's what they're going to expect. So that's all they're going to know, and they're not going to even think, could there be more? Could there be something different? They're not even going to know about other options because that's what they came for. They came for
Right.
help, guidance, structure. Now you're giving it to them, but it's only in one way. It's only in one form, and that I can understand how that
Yeah.
can be a little bit frustrating.
So it definitely caused me to curtail my style to be more relational. So any patient who says they've received treatment from me, like I'm gonna ask questions.
Yeah.
I'm actually gonna do some active listening. I will probably go maybe a little deeper than your average maybe APRN, not because I'm being nosy, but I do believe that the more information you give me you're enabling me to be able to help you.
Yeah.
Maybe it's, I'll go back to the domestic violence situation. Like, for example, I'm a survivor of a 10-year relationship of domestic violence.
Okay.
And I think when you elicit or ask a person questions about that, they're very afraid. They're very afraid to talk. They're very afraid to share their experience because they're worried about repercussions. They're worried about, okay, I told you, you wrote it in my chart. What are we doing here? And I get it. You're always worried about being exposed.
Yes.
And also, like I said, the repercussions for telling your truth, right?
Exactly.
So
I was for 5 years, and
and I remember me and you talked,
We
did.
did.
Privately about it. And I think at the end of the day, if I'm talking to a patient and they're not getting any better and they start breaking down and crying and talking about how they just don't know how to get out, well, it's not necessarily for me to make a med change, but maybe it's a referral. Maybe it's connecting someone to Prudence Crandall or something that can assist them and help them. Right. Like how you said, they come to you for guidance, they come to you for help. Well, then believe it or not, that is my job.
Yeah.
My job is not just to prescribe. My job is to help the patient in whatever area that I can possibly help. And if it's not something that I can do, I am responsible. I have to be accountable for making sure that I find what that is.
And you being accountable is you taking responsibility for your practice, for your patients, for yourself as your role in their lives. So, question. As the therapist, as the person, that everyone comes to for help and guidance, and as you absorb that throughout day after day after day, I'm sure that sometimes it can start to weigh heavy on your spirit, maybe even physically. And I want to know, like, what do you do to take care of your mental health as the mental health person?
I don't mean to laugh because
do you? Can you?
So okay, so I don't mean to laugh because
it's okay. That's what we're here for. We're here to laugh a little bit.
You know what I mean? Like everyone, as they always say, a therapist needs a therapist, a provider needs a provider. I get it, but sometimes it's just finding the time and the day to be able to do it. However, that's no excuse. Everyone knows, like for example, I've been a nurse for over 20 years.
2 decades.
We're 2 decades.
It's crazy.
I will take care of everybody else before I would take care of myself. Like I could literally bandage you up, stitch you up, and then oh my God, like this thing is festering, and it will just stay there for like weeks. I won't do anything about it. I'm not the greatest at self-care, but I will say that I'm getting better.
Okay. Improvements.
One of the things that I do, because I'm bounded by HIPAA. I mean, don't get me wrong. I love my patients, but some of my patients are wild.
Yeah.
some of their situations are fucking diabolical, and I'm just like, this is insane.
Yeah.
How are you even a real person? How is this even a real situation? I have high profile clients who's been in the news. I have all those type of things, but my point I'm trying to make is, I can't talk about it, but I think people in my profession, we're really good compartmentalizers. We know how to put things away and try our best not to bring it home. I've had patients who killed themselves. I've had patients who overdosed. I have patients who, have done really bad things and they've legally had to go and handle their business. But I think at the end of the day, I have a thing where I always say, what you eat don't make me shit. So my patients always laugh when I say that.
That's
because
true.
It's like I can't really take on everything that people tell me and what they do, because I would literally go insane. Right. So I think for me, I have a way where I can just compartmentalize it. And then when things do get overwhelming, what I've been doing a lot more is traveling. So my best friend, I have 2 best friends. My best friend, Cammie, she lives in Brooklyn. And then my other best friend, Alexis, she lives in Miami.
Hey, Cammie.
Hey,
Alexis.
Cammie.
Hey, girl.
But what I end up doing is I'll maybe take a weekend once a month and I'll go visit them in either Miami or I'll go into Brooklyn. So,
Girls time.
I'm financially in a position where I can do that. And I think at first I'm like, people are like, you go every month? And I was like, damn, that's terrible. I shouldn't be going to. Yeah, I go every month.
Right, I go every month. Every day you get up and you do your job.
Yes, I'm taking the time. I
love that.
Don't care what anyone says. I'm taking the time.
But I love that. That's good for you.
That's what I do. Obviously my husband is a great supporter. I can always bounce some things off of him. So he's helpful. Of course, I spend time with my kids. I have other friends. We try to get up whenever we can. But I just try to, remember that I'm LaTanya as an APRN. I'm LaTanya as a wife. I'm LaTanya as a mother. But the most important thing, I'm LaTanya.
That's
so
right.
I can't lose me.
You're first,
right,
LaTanya.
Right,
Don't forget that.
That's true.
Because we wear many hats as women, as entrepreneurs, as mothers, all that stuff, right? But sometimes we forget the fact that, before we were any of those motherfucking things, we were just us. And when we lose that girl, sometimes it's so hard to be able to be true to ourselves because we can't even remember who that person was.
Yeah.
Because we're too busy trying on all these other hats and it's like sometimes, like you said, we just need to pause, take a break, reset, be around the people that we love and that love us. Rely on, the people that are there for us. Because sometimes also we don't realize that we do have a support system and that it's okay to rest on their shoulders. Sometimes we feel alone when we're not physically alone. We might have a whole family around us. You might be supported by wonderful coworkers all day, things like that. But sometimes we still end up feeling pretty alone.
Yeah.
And I just think it's so important to take that moment of self-care, whatever that means to you. Find it, figure it out. Figure out a hobby that you like to do, something that you can just be yourself. No one's judging you, and you don't give a fuck if they do or not. But for you, you're so blessed because you do have a wonderful family and a support system.
Yeah, for sure.
And unfortunately, we don't all have that. But it's important to look within yourself if you feel like you are struggling to get back to yourself, feel safe. If you're struggling to feel like you want to, progress in life and things like that, it's okay to look and seek help and seek therapy, because not all therapists are that stereotypical, older person, just writing notes and, not really paying attention to what you're saying on the couch and all that. Sometimes your therapist actually gives a fuck.
I think it's very important. I don't want to say, because don't get me wrong, like I just for like a, not disclaimer, just full disclosure, like I don't do like consultations. So a lot of times I'll get a patient call and be like, hey, I just want to meet with you and just see if you're a proper fit. And I'm just like, yeah, no. And the only reason why I say no is because, it puts the provider in a position where, like, this is not a situation where I'm selling myself. Mm-hmm. It's one of those type of situations where you can have your first appointment and then we'll talk about your goals. Mm-hmm. We'll talk about, I'm very collaborative. Yeah. We can go from there. And if you don't book again, you don't book again. But I mean, I'm not selling pussy. Like, I'm not doing that. So I'm yeah. I don't have time. I'm not going to do a 5-minute
Your time
check-in.
Is valuable.
Yeah, I mean, that's just not going to happen.
You got your degree. You went to school. You got your own shit. So, you're your own boss.
And like I said, I'm not saying it in a cocky way.
No, but you know what? No, you can say that in a way that is confidently true.
Like I'm just saying, like, I'm not doing that. But my point I'm trying to segue into that is, you kind of do have to make sure no matter what you find a right fit. So, yeah, it's kind of like the Cinderella thing. You might have to try on the shoe a couple times until you find the right fit. Yeah. I mean, because if you really think about it, if you try to do like these consultations, you're kind of doing the same thing. Yeah. And, sometimes you have to be leery of people who sell themselves, because if it ain't what you get, then you just wasted your time.
Well, my point being, thank you for that.
Yeah.
Because you're absolutely right. Is that you are living proof, just you being here today, that and sharing some of your story, right? That not every therapist is the same, and that you do have options, and that you are able to find somebody that you can relate to.
We out here.
Yeah, exactly.
We out here. There's still. It may not be. And again, this is super biased because I'm not great at networking, so I kind of, and it's not like in competition with anyone. I just don't, I don't like, I just feel like because I don't have time. I'm not able to network with like a billion other APRNs or providers, but I do know that we exist. I know that we're out here, and everyone's style is different, and it will fit someone's style of what they're looking for. Right. Like, I'm very, like, my patients already know, like, I'll have patients make referral, and it's so funny. They will tell them, listen, she is not for the weak. Do not book an appointment with her if you're not trying to, like, she will call you out.
Really get down to the nitty gritty.
She's gonna call your bullshit out. She's gonna give you these weird ass faces, and you're gonna be like, "What's going on?" Because my face always betray me. I'm such a Virgo, and you're gonna be like, "What is this?"
Oh, okay,
yes.
you're a Virgo. I'm a Scorpio.
So I'm like, they're gonna be like, "What is that?" And I'm gonna be like, because I've already figured you out. I know you're lying before you even tell me that you're lying, and I'm just gonna call bullshit. Yep. So I think,
like a Virgo would,
right? Mm-hmm. So I think my style is not for everybody, but I think for people who are really struggling and, like, go back to what you talk about, they come for guidance, they come for
they're
help.
ready.
They're ready, right? I think it's very important so people kind of know, like, okay. And that's another thing. I'm very solution focused. Like, we're going to talk about the past. I'll let you tell me all the things that happened with you and Jerome and how y'all broke up for like 18 years. But at the end of the day, we're not staying there. Like, we have to move forward, and you have to progress, and you need to, changes. It's not elicited if you're not uncomfortable. So I'm going to make you uncomfortable. Yeah. If you're not leaving like, oh, okay, then that means we didn't do no work. And I'm not saying you're leaving worse, but hopefully you're leaving, yes, you're thinking and leaving with greater understanding of my problem and what I need to do. And, change is, especially mental health, is a little subtle. It takes a little time. But just knowing that you have people that care about you, your therapist care about you, your provider cares about you, and they want to see you win. And that's another thing. Get with a provider that wants to see you win. I celebrate the smallest successes. Like, I've had patients be like, I ain't washed my ass in a week, Tanya. I'd be like, okay, so we doing virtual, right?
Because you're not coming up in here with all that
we doing virtual for a week? Okay.
Please take a shower.
But that's just say I'll get a text message. Hey, I actually showered today, and I will like send like a twerking meme, like, yes. Like,
but that's because you called them out on it too. Like, you're like, hey, we'll do virtual then.
Yeah, like, well, not even, but like, I'm silly. Like, I say, I say it as a joke.
I know.
But it's more of a fact of like, okay, you're telling me your circumstance. I know you feel ashamed about it, but that's work from here. Right. So that's work from there. So if you give them a small goal and they achieve it, all you do is just build on that.
Small victories.
You'll start seeing the change.
Small victories. It's really baby steps. I always try to remind people, I'm like, hey, don't forget who won that race that one time.
Yeah.
Because it's not about who gets there the fastest. It's about who retains the most along the way, gets there more righteously, right? And, going back to what you said earlier about, being able to give of yourself and have so many people, like, depend on you and rely on you. It must weigh heavy on you sometimes. I know you do your best to compartmentalize and leave the work at work and be at home. But, when you're home, what kind of things do you like to do at home? How many kids do you have?
So I have, my oldest son is Nasir, is 14, and my youngest son, Isaiah, is 12. So I only have 2 kids. That's about right. That's it.
About 2 kids. Yeah.
That's right.
Okay.
That's it.
Good.
I'm not gonna hold you. I don't really. I come home. My days are very long, so they usually start by me getting up by 6 something, and then I'm working at one site, and then I go to private practice in the evening, and I don't normally get home. It really depends. It could be a 6:30. Or I might get home at a 7:30 or 8. So I don't really honestly spend a lot of time at home. On the weekends, I've gotten better. I shorten because I do see clients on the weekend, but I shortened my availability. So now I'm more available at home. Both my kids play football, so I made that sacrifice where Sundays, I no longer, I used to always work every Sunday. Yeah. I don't work Sundays because I will not miss my kids' games.
That's good. Sometimes you have to say
things
no.
like that.
Yeah.
So I just have to set the tone. Sometimes I might do emergency sessions here and there, but for the most part, I just try to do a better job of balancing. I'm not always good at it. I have had friends cuss me out and be like, you need to spend some more time. But for the most part, all the people that know me know my heart and they know my intention. Yeah. I'm out here doing God's work. Yeah. I'm trying to help, and at the same time I'm healing myself.
It is. So. Yes, I totally feel you on that, because with every podcast episode that I do here with TraumCom, it's a little healing for me, because with every episode, there's a different overall theme, topic, and I let my guests talk about some of the things that they've gone through, which led them to where they are and how they feel about it now, right? Things like that. But when it hits home, it really hits hard, and I really appreciate everyone being able to come out and take the time to spend and talk about what makes you tick, you know what I mean? But you do good work, and
Thank you.
I want you to be, understand that I know you do, but like really, really understand, like you deserve so much, just as much as all your patients do. And it's so hard when you're a provider like LaTanya to be able to take the time. And I'm sure like many of you out there,
I think
we say put yourself first. We tell people we have to practice what we preach at the end of the day.
It's true, but I won't lie. I think sometimes I do have imposter syndrome. Like I remember one time I had a conversation with one of my best friends, and
That's
I told
real honest,
when I say imposter syndrome, like I get it. Like I have a lot of patients. My business is thriving, is doing good. I'm getting ready to expand my business to Florida. So I'm doing a lot, right? But
Yeah, a lot.
And a lot of people will think like, okay, that's very successful. But I think that's one of the things that people don't understand about like trauma. Like, for example, growing up and having sexual abuse as a child at the age of 10, and then having it happen where it kind of like paved the way to getting into an abusive relationship.
Yep.
And being raped by your partner and all these other things, I think that it breaks you down in a way where it's unfathomable, where I can't always necessarily equate my success as I'm this good of a person. I always struggle with feeling like I'm enough. And even though, and I think that's one of the reasons why I do so much, and I think that is a trauma response, because if I'm not helping someone or doing something, then to sit in those feelings are so uncomfortable. And I think I still struggle with that. I'm a little ashamed of it, but
don't be. You have nothing to be ashamed
I think
of
it's
at all.
if I'm going to be honest on the podcast,
Yep.
I think when we talk about self-care and all those other things, sometimes I don't think I'm deserving to even do self-care, because all the things that I have endured, like all the things that I've seen, all the things that has happened to me or has been done to me, it really sometimes robbed me of me feeling like I'm enough, or feeling beautiful, or feeling a person who is valuable and is this great person that you talk. Like even when you give me all these accolades and say that I'm so important, like inside I'm like seething. I'm like, ugh, could you stop saying that?
That's the trauma. that is the trauma in you screaming, and it's trying to keep you down. But you don't let it. But I know it's still like, it's almost like lays dormant in you, because I have the trauma too. I have sometimes I get home and I kick off my shoes after a great day and I post my posts and we had a great meeting at the Chamber of Commerce today, and the podcast went great, and we're doing so great business, and you don't think I don't sit down and I have a nice cry every once in a while and let all the feelings flow through me, the feelings of inadequacy. Sometimes when people tell me, oh, you're so intelligent, you're so important, just like you. You're so great, you're so smart, you're so independent. On the inside, I'm like, that's because I have to be. What the fuck do you mean?
Exactly.
It's almost like, ew, like, no. I have a hard time accepting compliments as well. That's the I have trauma. We have been through some similar
things.
traumas,
Yeah.
and especially like you said, with the sexual trauma that you went through when you were a child, that's gonna affect you for the rest of your life, but only in a negative way. You know what I mean? As long as you let it, because we're gonna have to heal from it, but it's never gonna happen overnight. And it's going to be something that we might think about. And I say affect us in some way. We're going to remember it. We're going to either block it out, remember it. Either way, we're doing something with it.
Mm-hmm.
And with you, I see that it made you so much stronger. And all of your trauma mixed together, moving here, being new to an area, a new school, having the bullying situation, the sexual abuse, the familial stuff, not really feeling seen and heard all the time, relationship trauma.
But you know what? Oh, I'm going to make sure I'm going to keep it together. But I think out of all the things that you're listing of the things that I've survived,
You have.
I think the worst trauma I have ever experienced, ever. And it's crazy because I don't even, I could talk about those things that has happened to me as if it's like I'm ordering something off a McDonald's menu.
Right.
I think I've processed it, even though I know sometimes I have residual things that has shaped,
Triggers.
Yep. I have
Everybody
things like
has
that,
triggers.
right?
Yep.
But I think a lot of your audience members or just people or patients in general, or just people, I never realized that's traumatic to lose a parent. So I recently lost my mom. It'll be 1 year. Actually, today, I was thinking about it driving and I got emotional. Today marks 1 month was the last time that I spoke to my mom while she was alive. And then April 29th is when my son actually found her deceased in her home. And as strong as I thought I was, 2024, I was a hot mess.
I am so sorry.
No, it's okay. And I think
tough.
that's the part that I'm still navigating.
Yeah.
I'm still navigating the loss.
It's still new.
I'm sorry.
Still
So I
so
think
new. It's okay.
I think that's the part where, when you think about, that's when your support system comes in. I'm very thankful. I have great friends. I had my friend Christine clean her blood off the floor. I had my friend Chantel come and help clean out her apartment. I've had, people, my friend Sarita, she just showed up out of nowhere. She lives in Orlando. She was super busy and she just came and just showed up for me. Those are the things that get you through these moments. So sorry to end it like that, but it's just more of the thing of
apologize. That's what we're here for.
I think at the end of the day, I still have work to be done and I'm still in my healing phase, but I'm just very grateful that I have people who don't play about me and really who are there for me for the right reasons and make sure that I'm okay.
Absolutely.
So that's why, when you're traumatized, it's very, very important to have that good support system because they constantly remind you that you are enough and they constantly remind you that you're okay.
I can't do this, but I got a tattoo a couple years ago.
Oh, I am enough.
Yeah.
I think I might get that.
I think
now you got me. I'm about to bite off of you.
I think we've talked about it 4 or 5 times throughout the show. I think you need to do it.
I will.
I think that's your next tattoo. It was liberating for me because it's right in a place where I can see it every day when I look in the mirror. And it is a constant reminder because the couple times that you said it throughout the show today, I almost wanted to interject and be like, I got that tattoo! I got that tattoo! I know how you feel, And at the same time, I'm like, it might, it's not the right moment, but when you said that just now, I just got the chills, girl, because my father was my best friend, and he was sick most of my life, and he had Hodgkin's lymphoma, cancer when I was young, and then developed into heart disease after radiation and chemotherapy, and then he had a major heart attack, and then a quintuple bypass, and then open heart surgery, and then another major heart attack, and then he actually flatlined, and then they brought him back, and then he was on a heart transplant list, and then his heart was at 4% for a while, and then I was 15 when he asked me to make the decision for him to get another surgery to open up his chest again or not, because they put in a pacemaker and defibrillator, and years later turns out to be a recall.
Oh, wow.
And that's when my 48-year-old father became deceased. But I have guilt with that because he was my best friend.
Yeah.
I was supposed to go. He was here with me my whole life, but after I had my daughter when I was 18, he moved down to Florida for the weather. It was better for his chest, his health overall. But when he moved down there, that was my heart, So he would come up and stay with me at my apartment for a week or two, often. So I went down there to visit him once, and I was going down there with my daughter to visit him. I took a week off work. I was booking the tickets, and he said, "You know what, Jack? I'll come to you." He said, "I know you can't really afford to take the time off work. I know, but I'll come to you." His birthday was August 20th. I was supposed to be there from the 24th to the 7th. And my father passed away in his sleep on September 3rd.
God.
So when you were sitting here talking about the loss of your mother and how hard it's been on you this past year, I still sit and cry for my dad like it was yesterday, and it's been 17 years. And I was pregnant with my son when my father passed. He never got to meet him, but I named him after him.
Oh.
So I see him in him every day.
That's beautiful.
But it's never the same.
It's never the same.
And don't forget, give yourself fucking grace. You're only in your first year of this.
Yep.
I blubber and cry and snot up and cry sometimes when I'm driving, when I'm at home alone, when I wake up in the morning, when I'm cooking. My dad was a chef. He taught me how to cook everything. He taught me how to do everything I know how to do. Everything I know how to do, that man taught me how to do. But the thing that your mom and our dad, and my dad and your mom, our parents, they left two strong, badass women.
Yep, they left a legacy.
And
we're carrying it.
We are carrying it. And
yes, ma'am.
Despite all the different traumas that we have, you chose to gather all of it up and make a career out of that.
Yes.
Make a lifestyle out of that. And take on other people's pain and help them. And I don't know if you know, but that says so much about you and your character.
Thank you.
And your kindness.
Thank you.
And you deserve all of the good stuff.
Thank you.
And you're going to get it. And you're working for it, girl.
Thank you.
And I appreciate you coming on the show today. We're going to leave off with just a couple of remarks. I would like to have LaTanya please freestyle a little something to leave us with. Just something off the top of your head, something from you that you want people to take from this, take from you as a person. If they see you in the street after seeing this this episode, what is something that you want everybody to take away from meeting you today?
Oh God, I would
Not
say
putting on the spot or anything.
I know. I wasn't expecting that question. I think the most important thing that I would say is, if we're talking about mental health, we're talking about trauma, all those things, the first thing I do want to say to put out is two things to take away from here. Please. The first thing is you cannot separate the mind from the body. Them two works very intricately with one another. So the same view that you would go and build your temple, take care of your body. I don't care if you're getting your body done. I don't care if you're taking care of your diabetes. I don't care. If you can put that effort, and it's literally innate, like you're not even thinking about what you need to do to take care of your physical health, please put that same effort into taking care of your mental health. Because if you're not taking care of your mental health, you deteriorate physically. Physically, if you're deteriorating, you will deteriorate mentally. please understand that they work as one.
Agreed.
And then the last thing is, you are not your trauma. You may be shaped and have certain things that has happened to you, but I'm not dirty. I'm not the girl that, you know, people pointed me out to be when I was getting bullied. I'm not ugly. I'm not these things that has been told to me for years and years and years and years. Yes, you might continue to struggle with those insecurities, but do understand that you are not the result of your past. You can always break, and I always say this to my patients, generational trauma doesn't stop in your children, it stops in you. Yeah. So it's very important to understand, you know, even though you have been through a lot, you know, that's your truth and that's your story, but it's really about how you want it to end. So, and you have control over that. You have full autonomy on how you want to live the rest of your life. So that's what I take. You know, we are out here, you know, as I told you, we are accepting patients, hopelifebehavioral.com. You can find me or any other provider. We are accepting referrals. That's fine. But even if you're like, oh, she's too much, that's okay. Just reach out to someone because we're there.
You do telehealth too, right?
Yep, we do telehealth.
Okay, over the phone. You don't have to
reach
travel.
out to someone. Mm-hmm. We accept all insurances. I'm really big about helping people who don't have insurance. So, you know, obviously I could work with you. You know, we accept Medicaid. Don't worry about all of that. Medicare, we accept it.
That's great.
But I think the most important thing is we are out here and you don't have to do this alone. So that's when I wanted to leave.
Thank you so much.
You're welcome.
We're just out here, you know, changing narratives, rewriting our own stories.
Yes, ma'am.
And but it has to start with you. So, again, thank you so much.
You're welcome. Thank you. Thank you. It's been a pleasure. I appreciate it. Thank you. Thank you very much.
Absolutely. Thanks. We'll see each other again soon anyways. Okay. All right. Thank you guys so much. I hope you enjoy the rest of your day, your night, whatever the hell you're doing right now. But I hope you took away a lot of positivity from today's show. And, you know, just keep following and keep following your heart.